Hello and welcome to the training video for the Invengenx Bovine Pericardial Tissue Patch. Let's start with a little more information about the product. The tissue patch is intended for use as a surgical patch for cardiac and vascular reconstruction repair, soft tissue deficiency repair, and reinforcing the surgery line during general surgical procedures. Please discard any unused pieces of tissue patches. Do not reuse, re-sterilize, or reprocess the device, as it may result in patient injury or death. Also, please do not use any expired or damaged tissue patches. Please keep the tissue patch moist until use. Please remember, the jar and box are not sterile, so only introduce the tissue patch into the sterile field. On the top, there will be a size label indicating which size and reference number you will be using. On the side label, you will see all the supplier information and expiration date. Now, for opening the package itself, we will break through the tamper-proof seal, so grab a blade or knife and pierce through the top and go ahead and open up the box. The very top layer will have a foam lid. You will go ahead and remove that. On the inside, you will find four things. First off, the jar with the tissue itself. Please reference the size label and expiration date and make sure it matches with the label on the side of the box. You'll also find patient labels, the instructions for use, and the patient registration form. Inside the actual operating scenario, you would want to be in a highly ventilated area and make sure that there are no particulates that can contaminate the product. Before opening up the jar, you will make sure that the jar itself is not contaminated or damaged. For example, there is no leakage and that the level of glutaraldehyde in the jar itself is at a sufficient level. Please ensure that the saline is prepared before opening the jar itself. The materials you would need are 2 sterile containers, 1 pair of atraumatic forceps, and 1 to 2 liters of saline. Please reference the instructions for use for the correct amount of saline per container. Now that we have all the saline prepared, we are going to go ahead and open up the jar. Please grab your atraumatic forceps and grab the corners of the tissue itself, and then you are going to place it into the first container. From here, you will grab the corner and gently agitate the tissue. This will be done for 1 minute per container. It is not necessary to continuously agitate the tissue for the entire minute. Please ensure that the tissue is completely submerged in the saline. The tissue patch is now ready for use. Allow the tissue patch to remain submerged in the final rinse container until ready for use.